back to Resistance Chicks. We want to take you, it's May 12, 2017, back to Britain, where there has been a cyber attack on the NHS, which is the National Health Service, at certain hospitals.
Hit by ransomware!
We want money.
It's like the pirates are out and they want the money. I mean, it's kind of serious. I mean, the patients are really affected by this. A major incident has been declared after NHS services across England and Scotland were hit by a large-scale cyber attack. Staff cannot access patient data, which has been scrambled by ransomware. There is no evidence, excuse me, I'm reading an article. There's been no evidence patient data has been compromised. The BBC understands up to 25 NHS organizations and some general practitioners have been affected. It comes amid reports of cyber attacks affecting organizations worldwide. Ambulances have been diverted. Patients have been warned to avoid some A&E departments, and there has been disruption at some general practitioner surgeries as a result of the attack. Prime Minister Theresa May is being kept informed of the situation, while Health Secretary Jeremy Hunt is being briefed by the National Cybersecurity Centre. So the NHS Digital said the ransomware attack was not specifically targeted at the NHS and was affecting other organizations as well. A massive ransomware campaign appears to have attacked a number of organizations around the world. Screenshots of a well-known program that locks computers and demands a payment in Bitcoin have been shared online by those claiming to be affected. NHS Digital said the attack was believed to be carried out by the malware variant WannaDecryptor. WannaDecryptor. NHS Digital is working closely with the National Cybersecurity Centre, the Department of Health and the NHS England to support affected organisations and ensure patient safety is protected. Our focus is on supporting organisations to manage the incident swiftly and decisively, but we will continue to communicate with NHS colleagues and we'll share more information as it comes available.
So, can we play this video that says, what is ransomware?
Yes, we can
find out exactly what's going on here. What are we dealing with?
This is breaking news happening right now. Thanks sent to us by Justin. Thank you, Justin. And
if it will play, if not,
we will play. There's another video up here that was playing. Yeah.
Managing my patients here in the A&E department, I had a lady today who had a severe back pain, which we call possibility of coda equina, which potentially could paralyze her down below her leg. And we have to divert her to other hospitals, Queen's Medical Center, for further management. It has also affected us in terms of that we have to go back to paper-based and paperwork in terms of X-rays and blood tests and documentation on the patient notes. It's getting a bit difficult for us because we've got a lot of patients here and it takes an awful lot of time for us to process the information on a paper system.
What do you think of people who would launch a cyber attack like this on hospitals and GP surgeries?
I think they are a bunch of what would I say, cowards sitting behind the screen trying to disturb people's lives and risking it for cheap gains in terms of money. And I hate to say that, unfortunately, although we have I can confirm we have the best health system in the world. And I'm proud to be part of it. And for some idiots to try to mess us about, I'm sure.
So, wonder who it is? We don't exactly know. They're wanting, let's see, they're demanding, looks like 300 or no, maybe what, 230 pounds in Bitcoin?
So, it's Bitcoin, but yeah, I don't know.
230 million?
No, not million. I think that they're just asking a very, very small amount. I don't understand. I would have asked for more money.
You think they're asking for $300?
It just says, I don't know what the equivalent of it is in Bitcoin. I don't know the transfer ratios if it's just exactly the same.
I would ask for more money.
Yeah, so this whole thing just seems to be ridiculous. And unfortunately, it is just going to cause a headache. And I'm thinking they're going to be able to take care of these patients, like he said, transfer patients to different hospitals for different procedures that they need done. But here comes Michelle in.
It says $300.
I know, that's what I'm saying. Not very much. All this craziness, I'm like, dude, if you can manage to do that, I would ask for more money. I mean, come on, $300? Dude.
Unless they're just showing the weaknesses.
which is probably more than likely. But I have always questioned the fact that our healthcare systems switched over from paper to computers. Like everything has switched over from paper to computers. When the grid shuts down, and someday it will, and everybody has to go back to, you know, the very basics, it is going to cause a headache. And this is just kind of giving you a little glimpse into that, I think.
I think so too. Yeah, it's showing the weaknesses in the system. They can be hacked any time of the, you know, grid goes
Right.
down, things like that. So, all right, we're keeping our eye on it, and
Yep.
I hope that people are okay.
Yep. All right, you guys. This is Lee Michelle signing off for Resistance Chicks, where it's not a conspiracy theory if
They
it's
only
the
want
truth.
$300.
I know. What is that? Or pounds, I suppose. Don't forget to like, comment, and
dollars.
subscribe to Mass Faith 3 and Resistance
Pounds
Chicks.
with another symbol.
Ring the bell for notifications.
This
Find
is
us on Facebook.
the
Follow us
dollar.
on Twitter. We love you. God loves you. And
God
God
bless.
bless.
I was cold all alone, no place for home every day, so afraid, but you called me.